Good day, everyone. I am Leila S. Manalansan, and together with me are my groupmates, Kisha Nicole Cabarubia, Juan Paulo Alcalde, and Jeric Andre Bersatan. Before proceeding to the discussion proper, take note that sex and gender are two different terms. Sex is usually categorized as female or male, which means that biology is the one dictating it. On the other hand, gender refers to socially constructed roles, behaviors, expressions, and identities. Hence, it is not limited to being a male or female. Moving on to the discussion proper, when we say sex reassignment surgery, it refers to the surgical procedures performed to help individuals transition to their desired or self-identified gender. It is sometimes called gender reassignment surgery. However, you need to know that sex reassignment surgery is only a part of gender reassignment surgery. Sex reassignment surgery refers only to the reconstruction of the genital area, while gender reassignment surgery refers to all surgical procedures undergone by patients to become like the opposite sex. Also, many people today prefer to use the terms gender affirmation or confirmation surgery in calling it. Next, what is the purpose of these surgeries? First is to address gender dysphoria, which is the distress that occurs when the sex assigned at birth does not match your gender identity, and also to attain gender euphoria, as these surgeries allow the physical body to match their gender identity. In other words, these surgeries aim to help people live happily in their affirmed gender. Moreover, it was found in several studies that sex reassignment surgeries have contributed to the health of patients. First, it was found in a study in 2017 that 94 to 100% of people are satisfied with their gender reassignment surgery results. Also, individuals are experiencing long-term mental health benefits after undergoing one, as shown in another study in 2019. The finding states that a person's odds of needing mental health treatment declined by 8% each year after the procedure. Therefore, it can be observed that most people who chose these surgeries experience improved quality of life.
What parts of the body can be done for sex reassignment? Gender affirming surgery gives transgender people a body that aligns with their gender. It may involve procedures on the face, chest, or genitalia. Common transgender options include facial reconstructive surgery to make facial features more masculine or feminine, chest or top surgery to remove breast tissue for a more masculine appearance, or enhance breast size and shape for a more feminine appearance. Lastly, we have the genital or bottom surgery to transform and reconstruct the genitalia, all of which that are mentioned are applicable to men and women. What are different types of sex reassignment? While surgery is just one option, not everyone who is transgender or non-binary chooses to have surgery. Depending on your age and preferences, you may choose hormone therapy to increase masculine or feminine characteristics, such as your amount of body hair or vocal tone. We also have puberty blockers to prevent you from going through puberty. And lastly, you can opt to choose voice therapy to adjust your voice or tone or help with communication skills, such as introducing yourself with your pronouns.
Modern-day male-to-female transsexual surgical techniques are well-defined and give good cosmetic and functional results because of its careful planning. The most common surgical technique for this is called the penile inversion vaginoplasty. This is basically the process of converting the male anatomy to female by removing the penis and reshaping the genital tissue to appear more feminine by using the primary genital skin as a lining for the neovagina. Diving deeper, the surgical technique can be divided into 7 major steps. Let us look at a surgery performed by De Silva et al. In 2021. First, a neovaginal cavity was created between the prostate and the rectum, and the incisions were made to expose and remove the testicles along with the spermatic cords. Then, the penis was degloved and a skin flap was created. Next, the third and fourth steps included the excision of the dorsal part of the glans, along with its neurovascular bundle, and the urethra, along with a portion of the bulbous spongiosus muscle. Fifth, the neoclitoris was positioned at the symphysis pubis by removing the corpora cavernosa. Then, the corpus spongiosum and urethra were shortened, resulting in the creation of an inverted penile skin flap, which will be pulled into the neovaginal cavity to become its walls. Sixth, the surgery was polished up by removing the excess skin, enclosing the remaining skin and subcutaneous tissue. Lastly, an mons pubis was created, and the genital area was treated to avoid infections. After surgery, patients are discharged within 2 days, and follow-up visits are performed in 7 days and in 1, 2, 3, 6, and 12 months. And as you can see in this image, the surgery performed by De Silva et al. Was quite successful. Following the surgery, feminizing hormone therapy was then applied to patients. This aimed to develop secondary sex female characteristics while suppressing the male characteristics by stimulating the breast development, widening of the hips, inhibiting the growth of facial hair, and increasing voice pitch. One of the most popular methods is to combine estrogen, or 17-beta-estradiol, with an androgen blocker, usually spironolactone, which both must be taken daily. Overall complication rates have been reported at 32.5%, although most are minor wound complications. Urethral stenosis, or the narrowing of the urethra, was the most common complication requiring reoperation at 15%. Serious complications such as rectal injury, necrosis or death of bodily tissue, and rectovaginal fistula, an abnormal connection of the rectum and the vagina, are fortunately uncommon but can be devastating for patients.
Let us now move on to female-to-male surgery. A variety of surgical procedures are used in sex reassignment surgery for female-to-male transgender patients in order to change anatomical characteristics and provide physical traits that are more comfortable for the trans man's identity and function. This can take a variety of methods such as breast removal or genital region modification. A person will first receive testosterone replacement therapy before undergoing female-to-male gender-affirming surgery. After that, they might have one or more of the following procedures. First, breast restructuring. Subcutaneous mastectomy, which involves removing breast tissue, is frequently performed on patients undergoing surgery to transition from being female to male. Additionally, the nipple's appearance and placement will also be changed by the surgeon. The growth of chest hair will be induced by testosterone therapy, which was mentioned earlier. Second, the removal of the uterus, ovaries, or fallopian tubes. If hormone therapy does not stop menstruation, a person may decide to have this type of surgery if they are uncomfortable with their uterus, ovaries, or fallopian tubes. The partial hysterectomy. The uterus is the only organ removed by the surgeon. During a total hysterectomy, the cervix will also be removed. Third, retardoplasty. A mathoidoplasty is a procedure used to create a new penis or penis. The clitoris is converted into a penis in this process. Before the procedure, a person will receive hormone therapy to enlarge the clitoris. In a vaginectomy, the surgeon also removes the vagina during the procedure. However, a mathoidoplasty-induced neopenis is frequently too small for penetrative sex. Fourth, we have phalloplasty. Skin grafts from the arm, thigh, back, or abdomen are frequently used in phalloplasty procedures to create a neopenis. According to medical professionals, using skin from the forearm when creating a penis is the best option. A phalloplasty produces a larger penis when compared to a methoidoplasty. This neopenis, however, is unable to stand up by itself. And the fifth, scrotoplasty. Scrotoplasty, or the creation of a scrotum, may be chosen in conjunction with a methoidoplasty or phalloplasty. A surgeon creates a scrotum by hollowing out and positioning the labia majora and inserting silicone testicular implants. And now, the risks. Transmasculine bottom surgery carries a number of potential risks, including but not restricted to bleeding, infection, slow wound healing, hematoma, nerve damage, failure of the transplanted tissues to survive, unsightly scars, exposure of the prosthesis, damage to the urinary tract, abnormal connections between the urethra and the skin, painful intercourse, and anesthesia risks. And that's it, guys. I hope you learned something. Thank you for listening.